Well, in pediatrics, one of the biggest things and most frequently seen things that we deal with is ear infections. And it happens throughout the year. You know, obviously we see it more in winter, but in the summertime we still have a fair number of kids who are coming in with ear pain. And definitely, you know, 10, 20 years ago, parents used to just be able to call in and get a prescription over the phone, but we don't do that anymore. And so we do ask all parents to come in if they're worried about their kids having an ear infection. Treatment options are traditionally have been antibiotics, but just in the last couple years, the American Academy of Pediatrics have actually changed some of the options that we can do. One of which, and I think it's a big change, is possibly not treating their ear infection and just watching and waiting and seeing how the child does over the course of 48 to 72 hours. And I think that is a big change because I think we're so used to giving antibiotics for ear infections. But what we do know is that especially the older you get, the more likely that your ear infection is going to be caused by a virus rather than a bacteria, and obviously antibiotics will not treat that. Typically, if it's mild pain, we'll recommend ibuprofen or Tylenol. There's also kind of ear numbing drops that we'll give. But you know, the kids that we really talk about with not doing antibiotics are if they are pretty comfortable and if they don't have a fever. And so those are the kids that we really do explore that option with. And I would say in my experience, most parents nowadays would prefer not to do antibiotics unless they had to, and they're usually pretty comfortable with that plan. So I do feel like we're seeing more of a change towards not giving antibiotics if we don't necessarily need them.